I'm going to read this article and then I'll put it up in the corner over the video. What we're talking about is survival rates of breast cancer patients. Let's just talk about, generally speaking, average 5-year survival rate for people with breast cancer is 89%. The 10-year rate is 83%, and the 15-year rate is 78%. If the cancer is located only in the breast, stage 1, the 5-year survival rate is 99%. More than 70% of breast cancers are diagnosed at early stage. All right. All survival statistics are based primarily on the stage of breast cancer when diagnosed, but some other important factors are also listed below that have to do with survival. The stage is really important. Stage 0 almost never comes back. That's when they just cut it out. Stage 1 invasive breast cancer has an excellent survival rate. The chances of dying of stage 1 within 5 years is 1 to 5% if you pursue recommended treatments. Stage 2 breast cancer is also considered an early stage breast cancer. There's a slightly increased risk to your life versus stage 1 breast cancer. Altogether, the risk of stage 2 of threatening your life is about 15% in 5 years. Late stage breast cancer, stage 3 and stage inflammatory and stage 4. Stage 3 breast cancer has a higher risk to your life with 72% survival at 5 years. They swapped that one. They go back to survival on that one. There are many individual tumor-specific factors that can change this survival rate. Inflammatory breast cancer, or more worrisome, stage 3, overall, the 5-year survival rate for inflammatory breast cancer is about 50%, 50. Then finally, stage 4 breast cancer means that the cancer has spread beyond the breast to other organs or parts of the body. The metastases are not viewed in the general to be curable. The treatment is aimed at helping people live longer with their cancer. This type of cancer carries up to a 75 to 80% chance risk of dying within the first 5 years. All right, so there's some other components. When you get tested for breast cancer, you also find out if you're progesterone positive, estrogen positive, or HER2 positive. All right, these are all different combinations that tell you more about your cancer. If you are triple negative, that's when none of them, your cancer is not run by any of them. It's considered a more aggressive breast cancer, and it does require chemotherapy if you have triple negative breast cancer. The risk of dying is higher than standard statistics quoted for each particular stage, all right? If your HER2 positive breast cancers are also more aggressive tumors, the good news is we now have incredibly effective targeted chemotherapy and immunotherapy for HER positive cancers. There's a video that I'll show you. I'm reading from a site, and I'll show you all of this on the screen. Cancer at a young age. Women younger than 40 have a higher chance of being diagnosed with more advanced stage of breast cancer. Also, the specific cancer type younger women develop has a higher chance of being more aggressive. Triple negative, estrogen negative, or HER2 positive. As a result, age is a relative risk factor for survival. And then, of course, untreated breast cancer is the worst prognosis out of all of them. So now that we talked about that, I want to talk about the caveat that I think is what I'm running into, where I've heard about people being clear for cancer and then they come back 15 later with cancer again. And the reason is that if you are ER positive, which is what I am, ER positive cancers can linger for years after treatment. And I'm going to be posting an article that was written in 2017 but has been recently updated. All right, so even 20 years after a diagnosis, women with a type of breast cancer fueled by estrogen still face a substantial risk of the cancer returning or spreading. According to an analysis from an international team of investigators published in the New England Journal of Medicine in 2017. This was updated though. Standard treatment for estrogen receptor positive or ER positive breast cancer includes 5 years of endocrine-based treatments, tamoxifen, or aromatase inhibitors, both of which are taken as a daily pill. Researchers from the Early Breast Cancer Trialist Collaborative Group analyzed data from 88 clinical trials involving almost 63,000 women with positive breast cancer. The patients all received endocrine therapy for 5 years and were free of cancer when they stopped therapy. Over the next 15 years, however, a steady number of these women saw their cancer spread throughout the body as late as 20 years after the initial diagnosis. Even though these women remained free of recurrence in the first 5 years, the risk of having their cancer recur elsewhere from 5 years to 20 years remained constant. The risk of recurrence was directly tied to the original cancer size and characteristics and to the number of lymph nodes that were cancerous. Among patients who were recurrence-free when they stopped endocrine therapy after 5 years, the highest risk of recurrence was for those with originally large tumors and cancer that had spread to 4 or more lymph nodes. These women had a 40% risk of distant cancer recurrence over the next 15 years. Women with small, low-grade cancers and no spread to the lymph nodes had a much lower 10% risk of cancer spreading distantly during the next 15 years. It's remarkable that breast cancer can remain dormant for so long and then spread many years later, with this risk remaining the same year after year and still strongly related to the size of the original cancer and whether it had spread to the nodes. All right, so if you have HER positive, you have to worry about it. You have to worry about it. It does seem like, all right, if you are progesterone or if you're estrogen positive, you have to worry about your cancer no matter what, is basically what this article is saying. And depending on how bad it was at the beginning is like ups the chances of reoccurrence. So some people are looking at extending endocrine therapy for 10 years instead of 5 years because breast cancer survival rates are in 5 years. What's crazy though is I have heard that sometimes cancers can mutate. So a cancer that was not HER positive or ER positive can change to that. So that's kind of sucky because if it goes into that ER positive, then all of a sudden you have the risk of it running dormant for a really long time. So it said to assess 20-year risks, we had to study women who received their breast cancer diagnosis many years ago. We know that treatments have improved since then, so recurrence rates will be somewhat lower for women who were diagnosed more recently. The data suggests that women with ER-positive breast cancer should at least consider taking anti-estrogen therapy beyond 5 years, the author says. These data can be used by patients and their healthcare providers as they consider whether to continue taking anti-estrogen therapy beyond 5 years, weighing against side effects and toxicity of the therapies. So I guess, what does that mean? That can mean a lot of different things. I mean, I do think it means that nobody is safe. The reoccurrence rate might be low, but if it is mutated, which it can, then you could be right back in the seat where your ER positive cancer might pop back up again. So I'm sure all of this will change, like they said, as treatments get better and better. And all that tells me is that I need to stay the course for my treatment and focus on that and focus on being as happy and healthy as I can be in order to beat this disease, or at least to live with it at least another 20 years. I would be thrilled to get another 20 years, honestly.